Welcome to Health Nugget Media Channel, where we provide health-related nuggets and answer critical health questions to give valuable guides. Please, subscribe to this channel. Today's topic we wish to address is acute myeloid leukemia, causes, symptoms, treatment and prevention. Acute myeloid leukemia, or AML, is a type of cancer that affects the bone marrow and blood cells. It is a rare and aggressive form of cancer, accounting for about 1% of all cancer cases in the United States. AML is more common in adults than in children and is more commonly diagnosed in people over 60 years of age. In this video, we will discuss what AML is, its causes, symptoms, diagnosis, treatment, and prevention. What is acute myeloid leukemia? Acute myeloid leukemia is a cancer of the blood cells. It starts in the bone marrow, the spongy tissue inside the bones where blood cells are made. In AML, the bone marrow produces abnormal white blood cells, red blood cells, and platelets. These abnormal cells do not function properly, and they can accumulate in the bone marrow and blood, causing a range of symptoms. Causes of acute myeloid leukemia. The exact cause of AML is unknown, but there are several risk factors associated with the disease. These include exposure to radiation, certain chemicals such as benzene, smoking, and certain genetic disorders such as Down syndrome. According to a study published in the Journal of Clinical Oncology, approximately 20% of patients with AML have a family history of the disease or another hematologic malignancy. Symptoms of acute myeloid leukemia. The symptoms of AML can vary depending on the stage of the disease. In the early stages, there may be no symptoms, or they may be mild and easily overlooked. However, as the disease progresses, symptoms may include fatigue, weakness, shortness of breath, frequent infections, fever, and easy bruising or bleeding. According to a study published in the Journal of Clinical Oncology, symptoms are often non-specific and can be similar to those of other types of leukemia or blood disorders. Diagnosis of acute myeloid leukemia. If a doctor suspects that a patient has AML, they will perform a series of tests to confirm the diagnosis. These may include a physical exam, blood tests, bone marrow biopsy, and imaging tests such as a CT scan or MRI. According to a study published in the journal Blood, bone marrow examination is essential for the diagnosis of AML and to determine the specific subtype of the disease. Treatment of acute myeloid leukemia. The treatment of AML depends on the subtype of the disease, the patient's age and overall health, and other factors. The most common treatment options include chemotherapy, radiation therapy, bone marrow transplantation, and targeted therapy. According to a study published in the New England Journal of Medicine, intensive chemotherapy remains the standard of care for most patients with AML. Prevention of acute myeloid leukemia. There is no guaranteed way to prevent AML, but there are some steps that people can take to reduce their risk. These include avoiding exposure to chemicals such as benzene, quitting smoking, maintaining a healthy lifestyle, and getting regular checkups with a doctor. According to a study published in the Journal of Clinical Oncology, modifiable risk factors for AML, such as smoking and benzene exposure, should be avoided. In conclusion, acute myeloid leukemia is a type of blood cancer that affects the bone marrow and blood cells. The causes of AML are not completely understood, but there are several factors that may increase the risk of developing the disease. If you experience any of the symptoms of AML, it is important to see a doctor for an evaluation. Thank you for watching this video. Try to comment below and share this video. Please, don't forget to subscribe to this channel. Thank you once again.